Cognitive behavior therapy. Many therapists combine important features of both behavior therapy and cognitive therapy to form cognitive behavior therapy. Cognitive behavior therapists set explicit goals for changing people's behavior, but they place more emphasis on, that is, there more behavior therapists do on changing people's interpretation of their situation. For example, most of us become very upset if we see a video news report showing a fatal automobile accident, right? We would be much less upset if someone told us that the film was a special effects simulation. Similarly, cognitive behavior therapists try to help clients distinguish between serious problem and imagined or exaggerated problems. They help clients change their interpretations of past events, current concerns, and future possibilities. Cognitive behavior therapy has become one of the most widespread forms of therapy, especially in the United States. Let's see what's humanistic therapy. Humanistic psychologists believe that people can decide consciously and deliberately what kind of person to be, and that what naturally strive to achieve our full potential. However, people sometimes learn to dislike themselves because others criticize and reject them. They become distressed by the incongruence. You know the meaning of incongruence, that is mismatch between their self-concept and their ideal self. According to humanistic therapists, once people are freed from the inhibiting influences of a rejecting society, they can solve their own problems. The best known version of humanistic therapy is person-centered therapy, pioneered by Carl Rogers, which is also known as non-directive or client-centered therapy. The therapist listens to the client sympathetically with the total acceptance and unconditional positive regard. Most of the time, the therapist restates what this client has said to clarify it, thus conveying the message, "I'm trying to understand your experiences from your point of view." The therapist strives to be genuine, empathetic, and caring, rarely offering any interpretation or advice. So next, let us see what's family systems therapy. The family systems therapy, the guiding assumptions are the most people's problems develop in a family setting, and that the best way to deal with them is to improve family relationship and communication. Family systems therapy is not exactly an alternative to the other forms of therapy. A family therapist can use behavior therapy, cognitive therapy, or other techniques. What distinguishes family therapies is that they prefer to talk with two or more members of a family together. Even when they do talk with just one member of a family, they focus on how that individual fits into the family and how other members of the family have learned to react to him or her. Solving the problems requires changing the family dynamics as well as the individual behavior. For example, a young woman with anorexia nervosa, that is actually may have parents who are excessively demanding or may have other difficulties within the family. Providing treatment to only the women with anorexia would be pointless. So it is necessary to enlist her parents' help in monitoring her eating, but without blame, criticism, or dominance.